started to not waste anyone's time, and so we can kind of dive in here. So welcome to BEARCATS Health, Keys to Caring for Our Aging Population, presented by the University of Cincinnati Alumni Association. I'm Anna Gormley. I'm Program Director of Alumni Engagement for the College of Allied Health Sciences and James L. Winkle College of Pharmacy. It's great to see all of you, familiar faces and some names today. I'm co-hosting this session with my colleagues Gage Woolley and Bree Coggins, who support alumni outreach efforts for the College of Nursing and College of Medicine. The UC Alumni Association is here to support alumni success by positively impacting personal well-being and professional trajectory of our graduates. BEARCATS Health Sessions provide health and wellness resources, unique opportunities to learn about critical healthcare topics, and tools to improve quality of life for UC alumni in the BEARCAT community. Be on the lookout for more BEARCATS Health Sessions soon. A few housekeeping notes. Please make sure that you are on mute to prevent feedback and background noise. If you do have questions during the session, you can please type them in the chat. We'll monitor that throughout the presentation, and then we will also have time at the end for questions. And also, we are recording this session today, and then the recording will be shared with you all in the next few days as well. Now to introduce our speaker. Antoinette is a licensed social worker and two-time alumna from the University of Cincinnati. Following her education, she embarked on a fulfilling career, dedicating her efforts to the Cleveland Treatment Center, where she played pivotal roles as a prevention coordinator and a chemical dependency counselor. In 2017, Antoinette transitioned back to Cincinnati, where her commitment to community impact persisted. She was employed with the Hamilton County JFS for 2 years before moving to the Council on Aging. At the Council on Aging, Antoinette has held multiple roles of case manager, supervisor, senior building coordinator for older adults, and now as project manager. She has helped coordinate vaccine clinics, social isolation programming, and links older adults to resources as needed. In 2023, Antoinette spearheaded developing an entrepreneur program for preteens, equipping them with employability skills through workshops. This innovative program also facilitated connections between the teens and older adults in the community. The curriculum implemented by Community Happens Here in January 2024 has already made a positive impact. Welcome, Antoinette. I'll turn it over to you now.
Thank you so much for that warm introduction, Anna. I appreciate it. Thank you to UC for allowing me to come to Alumni Association to do this presentation. Today, I'm going to go through my agenda, and we're going to discuss keys to caring for our aging population. We've completed our welcome and introduction. I'll go through the presentation, and we've definitely saved some time for questions and open discussion towards the end. So why don't we get started? Can everybody put into the chat, if you're able to, tell me what is your capacity and how are you connected to older adults? Are you a caregiver? Are you a volunteer? Are you employed with an agency that works with older adults, or do you work with older adults in another capacity? I'm just interested to see who is in the meeting today. Okay, I see an assistant director adult day. I see care manager, caregiver. Okay, I see palliative care nursing, caregiver. I see employment, personal friend. Okay, we have therapists in here. Caregiver, I saw a teacher, helping family, dad, grandpa's 97. Okay, daughter of an elderly mom with needs. I see caregiver, nursing educator, students. Okay, so I see there's a lot of different roles. And to share a little bit about myself, I've been both a caregiver as well, helping my dad take care of my grandmother and grandfather. I've also been a care manager, and I've been a counselor to older adults. I volunteered with older adults, and now working at Council on Aging, we provide services for older adults. So I serve with them in many capacities, and we're just going to have a discussion about that today. So our objectives we're going to look at is the current trends with our aging population. We're going to look at person-centered care, some communication skills, safety and fall prevention, nutrition and hydration, social isolation and loneliness, and we're even going to talk about end-of-life care and advanced directives. So those are objectives today. And if you have any questions at all, don't forget to put them in the chat. This is going to be an engaging time that we have together. So if you have any thoughts or ideas you want to share, you can use the chat as well. And I'll ask you guys a couple of questions. Okay, our first slide is going to talk about aging. What is it? What does it look like? And just throw in the chat, what age do you think is considered old? If you had to consider an age. I asked my 5-year-old and my 12-year-old daughter what's considered old. And I'll tell you their answer. I see 75, 95, 65 and older, 80. Okay, I'm seeing some good ranges here. I see 100. Okay, 80, 70. Okay, 90. Yes, I love this. Nobody's thinking 10 years older than me. Okay, Nick, I like that. My 85, okay. My 5-year-old told me that I'm old, and my 12-year-old. And I was like, okay, so if you consider me old, what about your grandparents? What about the people that we care for, our great-grandparents and the people that we go volunteer with? What does that look like and what does that mean? So I asked them, what does aging look like? Can you give me some indicators of what does it look like to get older? And they started to identify some actual things that the National Institute on Health identifies, which is maybe your hair color changing, or you're getting loose skin, or it's becoming wrinkly, or your vision may be going bad, or your physical mobility may be changing. And that's basically what aging is your body's changing as you age. So even though I may be a little bit younger and I may not be in my 60s, 70s, and 80s, every year my body's getting older and every year I'm changing. But as I asked you all to put ages in the chat so we can see what your thoughts were, there's some ages that maybe Medicaid, areas on aging, or other programs indicate as older adults. So let's go ahead and look at this slide with the statistics on aging and prevalence in Ohio. The map I have shows Ohio. The first bullet point says that Ohio has 2.8 million people over the age of 60, accounting for 24% of the state's population. It's the 6th largest older population in the nation. 1 in 5 Ohioans is a caregiver for older adults. And that's pretty true, seeing as how I saw a lot of people indicated in the chats that you may be a caregiver. So that's 1 in 5 Ohioans. By 2030, more than 1 in 4 Ohioans will be age 60 plus. This is the fastest growing portion of the population that's age 85 plus. This group is most likely to need care by all of us, by the people who put things in the chat saying that you are a caregiver, you're working, you're volunteering, your family members are older, or you have friends or even neighbors. But looking at this, it says that from 2020 to 2040, Ohio's 85 plus population will grow by more than 50%. That's going to be a lot. So we're going to jump into some more statistics on our next slide. Looking at the Southwestern Ohio, nearly 365,000 adults age 60 and over live in our 5-county region, accounting for 22% of the region's total population. It includes 33,000 of people age 85 plus. From 2010 to 2050, our region's 85 plus population will double in size. That's the people who most likely to need care. This information can be found from another state on Ohio Department of Aging's website, and each state has their Department of Aging website where statistics and information can be found about the aging population. The statistics that I'm sharing with you today came from Council on Aging's projections from our communication department. And Medicaid also provides information and statistics on aging and populations. And the last bullet point I want to share is approximately 55% of residents over age 60 are female. So then you know the other percentage of what are male. And that's just interesting because if you think about the services that we're providing, the things that we're doing, we're going to need a lot of work, a lot of care, a lot of understanding to work with older adults in our communities. Now, what I want you guys to do is show me in the chat, what are some physiological changes associated with aging? I gave you all a couple earlier of ones that my 5-year-old and my 12-year-old shared, but what do you all think are some? I see mobility, decreased hearing loss, memory issues. Okay. Balance problems. I see vision, chronic pain. There's a lot. Frailty and increased risk of fracture. That's definitely one. Did someone say bad clothers, as in dressing bad? Okay. There are a lot of things that happen, and the physiological changes are actually slowing down and your functionality changing. So less social interaction, that's correct. Monica, chronic illness may be associated with physiological changes. I keep getting caught up on that word. So thank you all for sharing. Those are exactly right. Those are things that we see that happen on every day. There's mood and personality changes that happens. And I looked up a list of things, but you all conquered the list that I had to share from the National Institute on Health. So thank you very much for sharing those details. I was going to ask about common health conditions, but we know with those impairments, common health conditions that impact older adults can be many diseases. There can be cancers out there, dementia. Is there any other health conditions that anybody can think of? Okay, so thinking about stroke, Alzheimer's, dementia, cancers, diabetes, Parkinson's, all of those things that you all are putting in the chat as common health conditions, those have impacts on older adults. So let's think of an individual. I'm going to share with you my grandmother. My grandmother was aged in her latter 70s when she passed away. At that time, she had cancer. She was starting early onset dementia. Her hearing loss was going bad and her vision. So thinking about that individual and some of the things I shared, we're going to go through some of these other things in our slide and think about how we're supposed to care for individuals. So now we're going to talk about person-centered care. Thinking about the person in the middle. You want to make sure you recognize the individual and the personhood. You want to make sure you have a holistic approach. And you want to make sure you understand empowerment and independence with that individual. What you don't want to do is you don't want to focus on their diagnosis. You don't want to focus on them as just a care plan or the medications that they have to take, or you just providing food or coming to grandma's house and dropping off groceries. You want to make sure when you're working with that person, you understand who they are, develop a connection with that person. Knowing who they are, making sure if you're working with them, you can call them by their name, or if they prefer Mr. or Mrs. in front of them. Understanding how they communicate is very important, and not just treating the individual because you're working with them as another person to work with. So you want to make sure you create a positive social environment with them, fostering good relationships. You want to avoid assumptions with them. You want to understand their preferences. If you have time, get to know them a little bit. Understand their history or where they're coming from or their culture, maybe their individuality. One thing I love to do when I'm working with older adults, if they have on a hat, a brooch, a pin, a certain tie or something like that, I may ask them about it because sometimes they wear their favorite pins or things like that. And there's always a story to tell, and you can get to know them a little bit better. And getting to know the individual makes the care plan go a long way, makes treating them go that much easier. Or if you have to have a hard conversation with your grandmother, grandfather, aunt, or uncle, it makes it that much better because you took the time to understand that person versus looking at them through a different perspective. And the last point on here, supporting normality. Help them maintain aspects of their life that matter to them. Some people really like to be independent. And that's something about my grandmother I've always remembered. Even though I know she couldn't walk and it was time for her to give up her car and she couldn't drive anymore because she was having strokes and she couldn't walk and pay attention and focus, I had to bring back to her the times where she would drive from different cities and pick me up and take me to church or take me to the grocery store. And she loved those memories and she would talk about it all the time. So I tell people all the time is get to know the individual you're working with, serving, or caring for. Make sure it's person-centered and not just focused on different things. Okay, let's talk about communication skills. Working with older adults, we know that communication skills are huge. Working with anybody, communication skills are huge. I'll just put that right there. One thing I'm always working on is better ways to communicate with people. I'm a fast talker. So working at Council on Aging, the first thing they told me is training, Antoinette, you're gonna have to slow down. You can't talk a million miles a minute because people need to understand you. So I've been working on that. But let's look at some communication skills that we have. Pace. I put pace on here because it's very important to be mindful of how fast or how slow you're talking to an individual or older adult. Nonverbal communication. You want to be mindful to make sure you're not too tense or you're not looking angry or mean or mad or upset. If you're talking on the phone, did you know that people can hear a smile through the phone? And that may calm them. So sometimes when I'm talking to people, I may smile. Even with older adults, you can hear them smiling through the phone, asking them how their day is and different things that's going on. But can you imagine being in a hospital, delivering some news they don't want to hear, and that nonverbal communication from the doctor, the nurse, their caregiver, the aide, or the social worker could come across and change the individual's day? So depending on your nonverbal communication and how you communicate with that individual, whether you're looking at them and providing eye contact, whether you're smiling or you're looking upset or frustrated, can go a long way. I tell people all the time, if you're communicating with someone, be mindful of your nonverbals. If you need to take a break and go step in a hall and come back and just take a deep breath or count to 5, you can change your perspective and you can change the conversation with someone else, especially if it's a hard conversation. The next communication skill I want to bring up is goal directed. Ensure that your conversation has a point. My daughters tell me that I talk on and on. So one thing I make sure is that when I'm talking with older adults, when I was a case manager, I made sure they understood what I was talking about. What was the reason for my visit? If I had to ask them hard questions, I led with the point of the question. I provided education, but the education did not last forever. That's essential because most people only hear a small percentage of what message or communication you're getting across. So make sure your communication is goal directed. Ensures relationship focus. Understanding the individual, back from what I was talking about with person-centered care, you want to make sure it's relationship focused. And then the last part of communication skills is volume. I want to highlight volume because that's important as well. A lot of times people, when I've been interviewing them and we ask them about communication barriers, we ask, how would you work with an older adult if they had a communication barriers? Do you know that a lot of people say they're going to talk louder and clearly? And I'm like, sometimes louder isn't the case just because there's a communication barrier. There may be different things. Yes, we do know that older adults may suffer from hearing loss, but volume can come across as aggressive at sometimes if you feel like you're yelling at someone. So just be mindful of your volume and your tone. Is there any other communication skills or things that we should be mindful of when working with older adults? You can go ahead and put those in the chat too. We want to make sure that we address challenges related to hearing loss, cognitive decline, and language barriers. I tell people to seek resources if needed. Council on Aging has tons of resources for individuals. They have, one of the things they have is a language line where someone speaks a different language. You can get someone to translate. I think that's very good. If you need to communicate with a supervisor or someone higher up, if you're not understanding what's going on, someone can come in and intervene. If you're having a problem communicating with someone that may be of a different background or a different age or culture, always seek resources to help the conversation go smoothly. So let's look at the chat. Some things that I see is face the patient so that they can see your lips if they are having a hard time hearing. Listening and pausing. Active listening is key. Word selection is important. Yes. Asking the elder if they need to repeat anything. That's definitely important. Seating on the same level rather than standing above. That is important. Getting attention before you talk. That's definitely a good thing because you can talk on and on. If they're not paying attention, you may have to repeat yourself. So that is good too. Okay. Decrease environmental distractions if you can. Yes. I had an older adult that was playing, I forgot the name of the game she was playing on her computer, and I had to come over and do a care plan, and she was not paying attention to me. And I just felt like I had to redo the whole care plan because she had a lot of distractions going on with the TV going, and then she was playing a game on her computer. So decreasing distractions is important if you're able to. Okay. Well, let's take a look at the next one. The next one I see that I have listed is safety and fall prevention. Safety and fall prevention is huge. Being mindful of common safety risks for older adults is key. being mindful of their environment, where they're at, whether they're in their home, where they're going, if they're driving, what places they go to see if there's modifications or things for them. That's all very important. One thing that Council on Aging offers is we offer wellness classes, and some of those wellness classes can help older adults strengthen their hands and legs if they suffer from different ailments such as arthritis. We provide Tai Chi classes. We provide bingo size, which does exercises while they're playing bingo, just to help them understand the facts and different things related to safety and fall risk, or even fall prevention strategies. We also offer things such as home modifications for older adults if they're in a specific program and they qualify for them. I think that's important to be mindful of. But if you all had to think of an individual's environment, what are some safety risks that you might be mindful of if you were a case manager or a nurse making a home visit, or even a loved one? What are some important things that we should be mindful of? Remove throw rugs. Yes, that was the one key thing I was going to look at, is throw rugs can be a huge hazard for individuals, whether they're walking, using a rollator or wheelchair. Steps and handrails, yes. You want to ensure that the steps are sturdy, the handrails are secure, and they're not wobbly. You want to make sure clutter is definitely out of the way, as things can fall, there could be trip hazards or something can be loose. You want to make sure there's handrails and stairs. Yes. Grab bars in the bathroom. You want to remove the barriers to stairs. Yes. Shower chair. Yes, that's very important. You want to make sure the corridors are clear, that nobody's tripping. Yes, you guys are awesome. You're on it. We want to make sure all of these things are mindful when we're entering a home, or even let's say if a person is going to a senior center. You may want to make sure that senior center is ADA compliant. A lot of people think about the individual's home environment, or maybe the hospital or the place that they're going, but have you ever considered if your loved one or the person you're working with is going to a church, a senior center, a meeting, or even someone else's house? Is that place safe for them to go to? If you have the time and availability, you can have a conversation with them, go see the place, or just ask the place if you are referring them. In some instances, we refer our seniors to those places, and we want to make sure that they have the accommodations for our individuals. So some more things I see in the chat is encourage individual to use a cane or walker. Yes, that's huge. Sturdy shoes with tread. Yes, we want to make sure that they're not just walking in flip-flops that are slippery or things that are going to make them fall. That's important. Even I need shoes with sturdy tread, because you definitely want to make sure you're safe. Let's see, check to make sure that patient is sharing what OTC that can increase the fall risk with the doctor, and ideally limiting these. Yes, that's definitely important. Good lighting. I think lighting is essential, because a lot of times people can't see, especially at night. There's things out now that are like bathroom lights, or has anybody heard or seen the toilet lights? Those are some of the prizes we give away in bingo. So if the individual's going to the bathroom, they can make sure they sit where they need to sit and don't have any issues. So those are some cool things. Some clothing are a problem too. Yes, thank you for putting that in the chat. I didn't have that initially listed on my list, but I can understand how getting clothes on and off could be a safety risk if they need to take something off or get stuck in something. Yes, yes. Toilet lighting is interesting. They have ones that are like rainbow colors. They change colors and things like that. We give them away as prizes, and the seniors, they go crazy over them. I'm like, okay, I can change my toilet light blue and red and yellow at night. But I understand going into the bathroom, pitch black, trying to find where the toilet is could be problematic. So I definitely will want my loved one, or if I'm caring for a client, to know where they need to go and sit, so there's no issues, there's no startling or anything like that. Because sometimes the toilet light can be bright enough that you can illuminate the floor if they don't have the outlet for the plug-in light.
Antoinette, we did have a question.
Yes.
Won't Medicare Part B pay for an in-home evaluation of falls risks?
Medicare Part B. I can follow up on that.
Okay.
There are things that do pay for it, but it just depends on the individual, where they are and what they qualify for. Our ADRC specialist, Aging, Disability, and Resource Center, can answer those individual questions. So if someone has a question they want to call Council on Aging, you can contact our Resource Center, and they can individually look at your plan, your health insurance, and get those questions answered for you. But we do have programs as our elderly special ESP, elderly services program. They do assessments and they help people get home modifications or different services that they need. So we do provide medical equipment or help people get their insurance to provide that medical equipment for them. Thank you. Okay, so thank you very much for providing those insights and for that question. Let's go ahead and move on. The next slide, we're going to talk about nutrition and hydration. A lot of times people don't want to hear the word diet, but let's understand, what is the quality of a diet that an older adult should have? What types of things should they eat? Fruits, vegetables, same things we eat, right? But what type of things should they avoid? Can you indicate some things in the chat? I love eating apples. I like eating carrots. I like eating broccoli and things like that. And we know that older adults need those same nutritional items as well. They need those things to stay healthy as well as fiber. And that's exactly right. They need the same things we eat. But what are some things that they should probably stay away from, if you had to think of? It depends on their physical and health issues. Sugars, yes, avoiding dehydration drinks like coffee and alcohol, processed foods, that's a huge one. In this day and time, there's a lot of processed foods and fast food locations on almost every corner. You can go anywhere to get a burger, French fries, and chicken nuggets or fried fish. I feel like the more that's going on with marketing now with food is they're making sure food is marketed towards older adults too. They want to make sure they can come in and get their coffee in the morning, and they can come and get their fish on different days where they have the fried fish. And a lot of places do cater towards seniors in the mornings or certain days of the week, where I've gone to McDonald's and I've seen a group of seniors every day sitting there getting their breakfast. While that is a social connection, it may not be good for them to eat the food every day, but to have a cup of coffee here and there may be okay. And you're right, it does depend on their health conditions too. If possible, avoid prepackaged snacks and mostly carbs and salt. That's definitely things to be mindful of. And we want to make sure they have a quality diet. We want to make sure that they're hydrated. We want to prevent malnutrition. Does anybody know any key things to look out for with malnutrition? If you come across an older adult or a loved one who's malnourished, what are some key things that you can look at? Skin bruising, physical appearance, confusion. Yes. Some of the things: history of broken bones, feeling thirsty, fatigue, weakness, dizzy, dry mouth, headache, muscle cramps. Malnourishment is unplanned weight loss, feeling weak or tired, loss of appetite, swelling, or fluid accumulation, or eating only small amounts of time. If you notice any of these trends, what I'm going to tell you is to seek medical resources. We can't solve these problems on our own, and we could confuse some of these things that I mentioned with other health conditions. So the best thing that we should do is to seek the medical resources. But knowing some of these signs and symptoms and things is important to be mindful of. Oral care is definitely important. Thank you for that. Hydration and nutrition is very important. We know that a lot of older adults may have medications or may have different health conditions, and they have to eat based on that. So even though we talked about the same foods that we eat, older adults should eat, depending on whatever their health condition is, they have to be mindful of what their beverage intake is, what they're drinking, how many sugars or what's in it. We have to start understanding and reading the ingredients to the things that we eat to make sure we're getting enough nutrition in all of the food groups that we're supposed to be eating in. So thank you all for sharing. I appreciate that. And let's check out our next one. I see a physician may need to write a script for nutrition education, and then Medicare may cover the cost. That's absolutely right. You can get education and go in to see a nutritionist. You can get fact sheets. You can get a lot of different things depending on where that person's connected to. I know many medical facilities and hospitals, I'm not going to name them, but the hospitals that are in our region, they provide a lot of nutrition education, and people can sign up for free classes, webinars. I know AARP has some, Council on Aging provides some things. Right now, the farmers market is out and they give away free coupons to older adults 60 and older that they can sign up now and they can get access to free fruits and vegetables. So there's a lot of things out there to provide access to food education for individuals. The next topic I want to cover is social isolation and loneliness. Social isolation and loneliness has started to become prevalent since COVID-19. I'm gonna go back one slide. And it says on this slide here, nearly a fourth of adults aged 65 and older are considered socially isolated. The impact of COVID-19 isolated individuals in their homes, their apartments, and facilities. I'm pretty sure not only older adults experienced this during that time, but some things that we can be mindful of is recognizing the impact of social adults on their well-beings, whether it's affecting them mentally, socially, or physically. If someone's in their apartment and they live in an apartment building with older adults and they're not coming down for activities, they're not coming out for their meals, nobody's really able to check on them to see how they're doing. So they may skip doctor's appointments, they may not return phone calls or anything. And I've had clients at that time that were declining in health because they weren't going in to follow up with their doctors or getting medications. So we definitely want to be mindful of older adults with being isolated, not coming out, not connecting with individuals. So how do we combat social isolation with this population? Does anybody have any ideas of what we can do to combat social isolation with older adults or loneliness? Well, some of the resources that I can share with you all is senior groups. There, you can do daily phone calls, absolutely right. Adult day programs. There's different clubs out there. There's AARP. There's the area on aging, depending on whatever area you're in. If you're in a Council on Aging's region, we can refer individuals to different free community activities and programs. Catholic Charities has programs where they have daily phone calls or senior companions or grandparents companion programs for older adults. So we want to make sure that older adults are getting the connections. Yes, Little Brothers and Friends of the Elderly pairs adults with volunteers. There's virtual programs that people can connect to, library programs. There's all sorts of connections and activities that have blossomed and grown since this pandemic has happened and it's affected people and it's brought things out into light. Council on Aging did a program called Connecting the Dots where we connected older adults to programs and we provided our care managers with a lot of resources and places if they're starting to identify older adults experiencing social isolation so that we can connect them with other programs within a community. So if you have a loved one that you're realizing they don't want to come out their house or they're not talking to individuals, try to identify what their interests are. Try to see what they used to like doing or goals or things that they want to do in the future and connect them with something in the community. There's art for older adults. There's music programs. There's volunteering with pets if someone loves pets or if they had a pet. There's, I know there's card games that happen, board games. Of course, there's bingo. Everybody loves bingo. But there's all sorts of activities and things that are out there that are free because a lot of times people don't want to pay the resources or have the resources to access those programs, but there's a lot of free programs. And if people are inclined who are interested in paying for specific programs, there's clubs for older adults. There are centers where you can pay a monthly membership. But there's a lot of free programs that people can access. I know Meals on Wheels pairs older adults with different programs within a community as well that are free for older adults. So social isolation is huge, but just trying to combat loneliness and promote social connectedness is very important with older adults. Now I'm going to move on to the next slide, which is our last topic, and it's end-of-life care and advanced directives. People really don't want to have this conversation. They don't want to think about what's going to happen when I'm dead or what's going to happen as I transition. But I think it's important to start those conversations earlier on, just to know what the plans are. And it leads to less confusion, less stress, and you can discuss the end-of-life care and preferences or even advanced directives with your loved one or individual. You can address cultural and ethical considerations related to end-of-life decisions. And if you need help with these conversations, you can contact, of course, insurance programs. You can contact Council on Aging. And then there's Pro Seniors for legal help. There's people that create living wills and things like that all the time. So it's never too soon to start talking about the conversation, but there's appropriate ways and there's inappropriate ways to talk about things like this. So just be mindful of who you're working with. If you're in a hospital setting, medical setting, you know, there's social workers and staff that can handle those conversations. If you're talking to a loved one and you don't know the right words, you can contact resources to help lead or guide those conversations for you. Or you can contact your local area on aging and see if there's a case manager that can introduce that conversation. So I see somebody put in the chat that their mom gained a peace of mind with a living will and advanced direction and recommended by her nurse practitioner. That's exactly right, because it's writing down the things that you want to happen for yourself while you're still here, and you know that your loved ones will carry that out. My grandmother had a living will, and she had everything from the color of the outfit that she was going to wear to where she was going to be buried and everything taken care of. And when that time came, it definitely gave us a peace of mind as well, knowing that we can follow everything that she wanted when it was time. So I think that's definitely something to be mindful of. And once again, the resource, if anybody's interested, is contacting Pro Seniors. They can lead you through that legal help, get you that documentation and paperwork, and it's completely free if you're interested in having that conversation or even learning how to start that conversation with someone you're caring for or a loved one. So that's important as well. So thinking about everything that I've just gone through, all the topics, all the keys, the one thing that I want to leave you all with today, if I can plant a seed, if I can give you any bit of advice, if I can tell you something to just put a smile on your face when working with your older adult or loved one, is take time to understand the individual and the environment or environments is key to caring for and providing care for an older adult. You want to understand the person and their environment. You don't want to treat them as a diagnosis. You don't want to treat them as just a care plan or just the individual that you have to serve. You want to get to know them, figure out who they are, and then you can provide quality services for them. So I thank you all for your contributions today and your time. And I appreciate it. Thank you for that. I love smiling. I love people, and I love caring for older adults. I feel like my life's purpose is in the work that I do. So I appreciate it. Thank you. Now go to the next slide, and Anna, I'll turn it back over to you.
Yeah, so we'll go ahead and open it up to questions now. Feel free to continue posting them in the chat if that's easier for you, or you're welcome to take yourself off mute and ask out loud as well. So yeah, we'll just leave this open for some questions right now, and feel free to ask away.
There was one at the very beginning, if we're going to be able to share the slides with everybody.
Yes, I can make the slides in a shareable format and send them to you, Bree, to post. Okay. You're welcome. You're welcome. I tried to provide information for you all that I thought was important. I didn't want to give a textbook answer to too many things because we deal with different people that have different, you know, diagnosis and things like that. So I just wanted to make sure that we could talk about things and have a great discussion and engaging. So I thank you for that too. Home 52 is a transportation that Council on Aging offers. It is a part of Elderly Services Program if a client is eligible for it, or a person can privately pay for that program. I can put my email address. Bree, did you want to share my email, or did you want to share it if people want to ask questions about Council on Aging? Or maybe just a website where they can find additional resources. I'll do that.
Yeah, whatever you're comfortable with, Antoinette, that's fine.
Okay, I'll put our website here. It's help4seniors.org. So if you have any questions about Council on Aging and counties we serve, you can go to our website. We actually have a chat feature listed on our website where you can speak with someone directly about the services. My goal was not to come on here and talk about all the services because we have a lot. We service 5 counties, which is Butler, Warren, Clinton, Hamilton, and Claremont. We do in-home services. We do hospital services with Fast Track Home, helping people transition home. We provide care management, caregiver services, wellness, nutrition support. We do a lot. We do it all. So it's a great agency. You're welcome. You're welcome. Any other questions?
I have a question about the services you mentioned about the counties you cover. And I've noticed as I'm assisting seniors that some counties seem to not offer the services that another county might have. And so could you speak a little bit about that?
Yes, each county is different based on the funds or the services they provide, and that's based on the individual county and the commissioner, not commissioners, but it's based on the individual county entity. So for example, Hamilton County is a huge county. There's a lot of resources, and our biggest program is Elderly Services Program, and that's supported by the tax levy. So as you can imagine, there's a lot of people that live in a county and they pay taxes, and the taxes go back into the services for that program. So there may be smaller counties where there's not a lot of individuals residing there, and they may not have those services similar to Hamilton County and those programs.
That's helpful. I found the more rural counties that I work with seniors that I'm not finding as many services. Thank you.
It's different from county to county all across the state of Ohio. I grew up in Cuyahoga County, and my grandmother went through a lot of different services. Then I moved to Hamilton County, and I was like, wait, we have all of this stuff here that wasn't in Cuyahoga County. So it's definitely county specific based on the program. Even if you work at Council on Aging, we see differences all the time with the different counties that are available.
There's a question in the chat about any advice regarding hospice care.
Yes, for hospice care, we refer directly to Cincinnati Hospice or other programs because we don't provide that program in-house. We go right to the resources and experts who provide that care and those services. So we will refer you to the front door service of that program and do a soft handoff there that you can connect with their front door and get the questions that you need answered. I see another comment in the chat: an annual wellness visit and welcome to Medicare visit with a doctor is underutilized, but it provides payment to doctor or other providers to discuss concerns that often contribute to increased falls risk, such as an assessment of vision and suitable glasses. Thank you for that. I appreciate that. Forum on Aging is March 4th and 5th, 2025. Yes, I see that, Irene. Beautiful name. Thank you for sharing. I appreciate that. Okay, my mom gets an annual visit through a nurse practitioner. That's very important, making sure people stay up to date, connecting with medical providers, all the resources, dental appointments, vision appointments, seeing all the specialists they're supposed to see. I think those are all very, very important things to be mindful of. Yes. And sometimes if you're able to go to a doctor or send someone to the doctor too with a loved one, if you notice that they start to have memory loss, is a good thing as well. I noticed that my grandmother only told me half of what happened at her doctor's visits. So then we started talking to the doctor because she would come and tell us what she wanted to tell us. So it just depends where your loved one is at that stage.
I do have a question. You kind of referenced it in the kind of the last section about planning, and you kind of generally referenced, you know, things that are appropriate and inappropriate. Can you just talk about, you know, maybe just some landmines or some pitfalls you've seen people fall into where it's gone more into that inappropriate space, just, you know, for general awareness of what to avoid?
Yes, and you're related to the end of life advanced directives. Yeah, so the reason why it's important to talk to someone who's familiar with this, such as a social worker at a hospital or connecting with pro seniors, is because a lot of times people can be taken advantage of. There's older adults that have assets such as their homes, their cars, they may have trust and financial assets, and those things need to be taken care of the right way. We want to be mindful of who's going to pay for what's going to happen, or even what happens in a medical setting. Having a do not resuscitate, if that's what the individual wants, we want to make sure that's signed, those documents are completed, and they're filed the right way. A lot of times when those documents aren't in place, we've seen a lot of stress with families. We've seen a lot of arguments, deterioration of families, because those documents don't give direction. So people abuse funds, or things are held up in probate for a long time because there's no plan that's supposed to happen. Or if someone, you know, was in a car accident and something terrible happened, what are the next steps that someone wants for their life? Do they want to be an organ donor? How do they want to be buried? What do they want on their headstone? There's so many valuable things that can come from the end of life planning, and that's definitely important. Hospice service, if possible, yes, that's definitely good. definitely discuss that if the patient wants hospice. See, always use voice recorder for any appointment. That's good. Making sure the physician is aware that you're recording them to record the information in detail. That's very important too. That's good. Okay, and I'll share the last slide where my resources and information came from. I have Pro Seniors listed at the top with their website. I have the area on aging specifically for our area, but if you're in a different area, you're concerned about services, let's say in Brown County or Highland County, you can always Google the area on aging for that specific county and you'll get the website. There's a lot of resources with AARP. I shared the link with resources for caregivers and their families. So if you wanted to look that up in Google, or if you have a smartphone and you wanted to talk to your phone, or even look it up on a computer, AARP has a lot of resources. Catholic Charities, whether the individual is, connected to Catholic Charities or not, there's a lot of services for caregivers and others where they provide resources, education. Catholic Charities is connected to CAHS for Hispanic individuals that need services as well, so you can get that connection. There's a lot of programs across the state of Ohio through Catholic Charities, so that's good. Hospital networks, I always put this on here because a lot of people just think you go to your doctor, you see your doctor, and you go home. No, there's a wealth of resources in hospital networks. There's social workers, nutritionists, there's all type of specialists that can see you and provide the services or resources that you may need within a hospital setting. Some of the hospitals that we work with council on aging, they even have senior network groups where they provide social activities for older adults. And when I started to connect with them and find out all the resources that they had, I was shocked. I got the newsletter and I was like, wow. So connecting with whatever network the individual is connected to, seeing what they offer for them is good too. Senior centers, if you're looking for social connectivity, is important. All of the rec centers may have a schedule on their website and identify. There's a lot of libraries that have connections to senior activities as well. So those are just some resources that you can take advantage of if you're interested in connecting your older adult or loved one or client to a program. And then the last one I have listed is insurance plan. I know somebody mentioned that a little bit earlier in the chat. But insurance plan is important because a lot of people may not be mindful of the benefits that are available through individual insurance plans. A lot of people get over-the-counter cards where they may have funds on them to buy different products from the store, or some benefits may include food or transportation. People can get medical equipment from their health plan if their doctor writes a note, or prescription is what it's actually called. So those are a lot of things that you guys can look out for as far as resources. Care coordinators at hospital health systems are very helpful to connect with. Financial services, for example, yes. Here's a question, says, are there limitations for COA services due to financial status, i.e. services for only individuals on Medicaid or limited finances? So Council on Aging does an assessment to every individual, and you have to meet different levels of care to be connected to a program, and they do a financial screening with each individual to determine if the service is going to be free or if it's going to have a fee or a copay connected to it. So while I can't go into details on the individual, I will say generally people that come into the door will get an assessment or a screening, and they may be identified eligible for a program based on their age, based on their medical status, and then it goes from there and they do the financial assessment. So it just depends on where they are currently. But I will say that it's not only for people on Medicaid or limited finances. Medicare doesn't cover hearing aids, but some Advantage plans offer discount plans. Yes, something to look at for hearing impaired adults. Yes, there's a lot of services and resources. Thank you for sharing that. I appreciate it. Medicaid does cover hearing aids. Yes. Okay, and I'll turn it back over to you. Thank you.
Yes, thanks, Antoinette. And thank you everybody for attending today. If there are no further questions, you can feel free to kind of hop off. We will be following up with, again, the recording of the presentation. We can get the slides to you guys as well. And then for anyone those looking for a nursing or social work CEU, there will be evaluations for you all to fill out to get those as well. So just keep a lookout for an email from us with kind of all this follow-up information. But thank you all so much for attending, and be on the lookout for more BEARCATS Health sessions in the future.